Hi, my name is Gina Hurley. I decided to do my oral presentation on Borin neutron captive therapy, also known as BNCT. BNCT is a binary system that consists of two separate components to achieve its therapeutic effectiveness. Each component by itself is non-destructive, but combined can be highly lethal to cancer cells. The reason why I chose this is because with radiation therapy, you have the risk of you do have the effect of the surrounding good cell tissues and good organs to get damaged and even cause cell death in those organs and surrounding good healthy cells. With the BNCT, it is localized, so they are able to precisely target the cancer cells with this. There are two steps. The first step, the patient is injected with a tumor localizing drug that contains a non-radioactive isotope boron 10, which has a high tendency to capture thermal neutrons. Step 2, the patient is radiated with epithermal neutrons. The neutrons are then captured by the boron 10, which the reaction of the two creates a high energy alpha particle that kills the cells that have taken up a significant quantity of boron 10. So even if boron 10 is to get into the good cell tissues or the good organs, if it doesn't have a lot of it that accumulates there, like it does in the tumor cells, then the good skin tissue is still, or the good cell tissue and the good organs are still left alone, where they are non-harmed. With the BNCT, they are doing a lot of clinical studies, and it's been around. It was first introduced back in the 1900s, early 1930s, to be exact, by a scientist / doctor. There hasn't been a whole lot of studies done up until the early 2000s. Sorry, that's my son. Until the early 2000s. Late 90s, early 2000s. But since then, BNCT has been evaluated clinically as an alternative to conventional radiation therapy for some cancers, not all cancers, just some, like the head and neck cancers, the malignant tumors, recurrent cancers is also another one. But I believe that with the BNCT, if you are able to have more of clinical studies to where we can get this out into the medical field, I think that it would be of a more go-to treatment, because with conventional radiational therapy, you have the risk of affecting the good skin tissue or the good cell tissues and the good organs. For a head and neck patient, if they have cancer on their tongue and they have to get radiation treatment because they don't have the option of the BNCT, then the beams of the radiation then will hit the surrounding tissues, so your teeth. And with the radiation that stays in your body even after you've undergone all your treatments, so let's say your last treatment was this day, today's date, then 6 months from now, your radiation is just now starting to go out your body. So that radiation is still in all those good skin tissues, cell tissues, to where it is causing cell damage and even cell death in the good and healthy cells, just as much as it is in the malignant tumors, the malignant cells. So I believe that the BNCT would have a very higher rate of success with very less minimal risk as to surrounding good healthy tissue.